Zoom in a bit on the reality that's on the ground in Syria. The Assad regime has declared another major win, pushing ISIS out of their last stronghold around Damascus.
And as the regime continues to make those gains, the losses for civilians continue to add up. Take a look at this new report by the Safeguarding Health in Conflict Coalition. They monitor attacks on health care from hospitals to nurses and ambulances of 23 different countries. Syria saw by far the most, 252 strikes just in 2017. In New York, Christine Monaghan, she's a research officer at Watchlist on Children in Armed Conflict. Christine, great to have you with us. Explain to us a little bit, when we're talking about strikes on health, on medical facilities, what that looks like from your findings on the ground.
Sure. So thanks very much for having me. When we're looking at, aerial bombardments of medical facilities and personnel, particularly in Syria, you're looking at a deliberate tactic of conflict carried out by both Syria and its Russian allies, targeting, medical facilities that over the course of the past 8 years of conflict have tried to do everything that they can to prevent attack, going so far as to move underground and into caves. And in the wave of attacks that we saw throughout 2017, you can see that the bombs were specifically designed to break through those protective barriers, protective mechanisms, and hit the hospitals, destroy hospitals, and severely impact and limit civilians' opportunities to access health care that they most desperately need.
Christian, attacking medical facilities, especially those that are treating civilians, seems to be a breach in really the most basic laws of international warfare. Shouldn't the international community be doing more to focus on this particular aspect of the conflict?
Absolutely. I mean, as you just said, protection of medical facilities and personnel is foundational to international humanitarian and human rights law. And yet, throughout the conflict in Syria, we've seen complete gridlock in the Security Council and in the Human Rights Council to effectively address this issue. And so both Syrian regime and, again, its Russian allies have acted with impunity and continue to do so. We're making recommendations in the report that the Security Council and or Human Rights Council need to proceed forward with independent investigations, need to turn the regime over to the International Criminal Court, need to impose sanctions, whenever and however possible. And yet we just simply have not seen effective steps taken.
Well, in your experience, how possible is that? How realistic do you think that the UN, for example, though unable to stop those 252 attacks in 2017, could actually take that to a next step to investigate the Assad regime in another forum?
Well, I think we've seen some positive steps taken with the Human Rights Council initiating what's known as the Triple I in Syria. I think this is a sign that there is a possibility, there are inroads through the UN. I think the more public pressure that can be put on the regime itself and on Russia, particularly in the lead up to the World Cup, to make very clear that a couple thousand miles away, the regime is wreaking havoc on civilians' lives in Syria. I think that there's some inroads there that we need to keep pushing forward on.
Russia has certainly been a major force in blocking resolutions to that effect at the UN Security Council. Christine Monaghan, thanks very much for bringing us a little bit of that research. Incredible numbers, 252 strikes on hospitals just in 2017.